On the pandemic, then let's talk about the pandemic. So look, both of us, cards on the table, both of us loathe lockdown. I regard it as a atrocious intrusion on personal freedom. It has all sorts, and I've written about the impact on mental health. I wrote today about the rise in poverty, which I believe is avoidable given government policies. The difference between you and me is I believe lockdown is an unavoidable evil in order to prevent the transmission of a deadly illness that has killed, if we're going by excess deaths, which is, I would argue, as scientists have the consensus is the most reliable indicator. So the excess deaths above the 5-year average, 80,000 people, one in every 832 of our fellow citizens have perished in the space of a few months, even though most people haven't actually contracted coronavirus. So that's a measure of how deadly it is. Why do you oppose these dreadful measures that we've all had to, 2020, a terrible year, the worst year that any of us, that people in these countries have had to endure since the end of World War II? Why do you oppose measures which are there to prevent the spread of a very, very deadly illness?
Well, you make this presumption, this assertion that these measures do prevent and do protect. And I don't believe that this is so. There's quite a lot of work being done on the outcomes of political actions supposedly against the virus all over the world. And no one has established even any congruence between the stringency and severity of shutdown measures and the number of lives lost. And that's been the case from the start. And I think we were at liberty to doubt that it would work from the start. I think that to me, the whole idea of a government which can't even educate people after 11 years of schooling can control a virus is a bit fanciful. But leave that aside for a moment. The fundamental question from the beginning was one of proportion. Was the action proposed by the government, more or less a strangulation of the economy, a throttling of the National Health Service, an increasing attack on personal liberty, was it justified by the threat? It's a question that COVID-19 is a disease from which people die, but were they dying or likely to die in the quantities predicted, particularly by the modelling of Imperial College, which had a poor record of modelling in the past, I have to say, which was easily discoverable? Were they, in fact, preventable deaths in the way which the government proposed to prevent them? Were the measures, as I say, remotely in proportion to what was proposed, and did they work? And I think the answers to all those questions appeared to me at the time to be no. And I don't just take this view, plucking it out of the air. I was particularly impressed by what was said by a very distinguished professor of microbiological medicine, Sutrin Bhakti of the University of Mainz in Germany, whose writings and speeches of the time now read like prophecy, who said that this was the most terrible mistake, an overestimation of the danger, and would be bound to do particularly very grave damage to the healthy and old, which of course it has done, and to society in general, and was unjustified. The work of Professor John Ioannidis of Stanford University, who immediately spotted that the alleged levels of mortality being predicted were simply didn't accord with what we knew about the way the disease had behaved. And also very early on, the work of which the Financial Times, to its credit, picked up at the time, the work of Sunetra Gupta, another resident of my great city, Oxford, who was highly skeptical about Imperial College's idea of just how vulnerable the population would be to the disease. And then if you follow through the succeeding months, as I have very carefully, the actual figures of deaths and the nature of them, and you find that the supposed pandemic is in fact largely a statistical matter. But if it hadn't been for the government's incessant promotion of deaths as having been the consequence of COVID, where many of them quite probably were not, if the government had admitted that many of those who were dying were in fact people of great age who suffered from serious other diseases at the same time, then we wouldn't be in this state of panic, which allows us to be hurried into accepting these extremely drastic and damaging measures, which have, in my view, done permanent, probably irreparable damage to our society, and will leave our heirs and successors having to cope with the most enormous indebtedness for the foreseeable future.
So there's quite a lot there. So let me just try and just answer a few.
You asked. It's a big question. I thought I'd.
No, I know. No, I wasn't criticizing you. It's
no, feel free. I don't.
So in terms of the scale of the national disaster, I mean, I would put it to you that 80,000 people is twice the number of people who died in the Blitz. And when we're talking about the age, for example, this comes up.
Let me just respond to that, if I may, because the number of people who die in an aerial bombardment of a city is over a certain period of time is going to be of a certain order. One of the most shocking things that I could ever say during this, and I said it from the very beginning, is this: every day in this country, 1,600 people die. Each of those deaths is a tragedy for those directly involved, and I'm a great John Donne person. No man is an island unto himself, and the death of any man diminishes me. And I'm not. But 1,600 people die every day, and some of those die of respiratory diseases, particularly during the winter months.
Well, okay, but just on that,
a lot of people don't seem to realise that it's a matter of classifying deaths, which in many cases would have happened anyway, or not that much later, if there'd been no COVID at all. And the 1968-69 influenza, the so-called Hong Kong flu, which came to this country, I believe, killed more people.
Okay, well,
and there was no national crisis and no national shutdown.
That answers your point.
The BBC didn't go into a complete state of lists of deaths every night.
What you've just said there about Hong Kong flu answers your own point, though, surely, because the point was, you're quite right, there wasn't a lockdown. It did kill a significant number of people, but based on the circulation of the flu across the entire population. The difference is, in this particular instance, severe lockdown measures have happened. The vast majority of the population have not had coronavirus. We've done antibody tests quite extensively. The ONS looks at the proportion of people with antibodies. So we've had an excess death rate of 80,000 people. And I'll just show you. I'm not going to, this is not, by the way, not something I make a habit of, but otherwise I'd show you on a piece of paper. Let me just show you a little graph of antibodies, of excess deaths. So this is the 5-year average of deaths there plotted. And then you can see what happened in March. We have a huge increase in excess deaths. And then as lockdown measures kick in, it decreases. And then what we've had, as the economy was reopened without a functioning test and trace system, which they handed to Serco, those excess deaths, which now correlate, by the way, with the number of people, because testing's improved, dying of coronavirus, have gone up again and ended up already about a fifth above average. That is a huge, huge increase in deaths. In fact, there's no precedent on our records for that increase in deaths.
You're wrong about there being no precedent. I mean, there are very frequently in this country, there are
not since those comparable records began, which don't
have a battle of graphs. I've brought some of my own, but there's a very useful website called In Proportion, which goes into the numbers of occasions on which it's generally influenza rather than coronavirus. The number of occasions in recent years on which there have been very large numbers of excess deaths during the winter, almost every year in this country, as you will know, because the National Health Service has been reduced to its minimum possible number of beds, and probably too few. Almost every year, the National Health Service has a winter crisis in which there are excess deaths. And it's not by any means unprecedented or that big. There's also the other question of classification. And people, you would actually get Jenny Harris, I think, the Deputy Chief Medical Officer, saying quite early on, many of these deaths are deaths of people they're deaths of people with COVID, but that's not to say they're from COVID. But an awful lot of deaths were classified as being as a result of COVID, which were actually deaths of people who had COVID, had several other serious conditions as well. And you know as well as I do, the average age of death from COVID in this country is 82. Which is slightly higher than the average age of death in general.
So on that, this is
here is a problem that if you do.
So here's some very important points. Again, let me
because and feel free to do so, but I'll resist it. We've been quite successful in recent years in keeping old people alive for longer. But
okay, can I just answer a few of those points though? Because otherwise
there is a difficulty. If respiratory diseases come along, then old people, particularly once you have cardiovascular conditions, will die in larger numbers because they have been kept alive successfully longer. It's a measure to some extent of our success. But to make out of this that what we're suffering is something similar to the so-called Spanish flu of 1918 is simply false. It isn't on that scale. It doesn't begin to approach that scale, and it doesn't justify the level of national panic and frenzy which has followed from it. No one's questioning that there are people who have died.
Okay, well, let me respond to some of those points just quickly.
If you're going to list excess deaths, you also have to list the very substantial numbers of excess deaths, and the research is still coming in on this, of people who died because they missed cancer appointments and treatments and all kinds of other things as a result of the general turning away from the health service, which was brought about by the panic spread by the government and large parts of the media, which kept people from going for vital medical treatment. And a very large number of non-COVID excess deaths can be recorded here as well. And you have to be careful to separate those. The statistical issues of this are very complicated.
But let me just come back quickly, Peter. Come on.
Professor John Lee, the noted pathologist, has pointed out that it's a lot of the deaths which have been recorded as COVID may not actually have been so. And now we have this really strange thing, which is that both influenza and pneumonia seem to have practically disappeared from among us.
Well, they haven't. But let me just.
But the deaths from them are not being recorded. There's a difference, as same as in recorded crime and recorded deaths. There's a difference between recorded deaths and the actual facts of what's necessarily going on.
So, Peter, come on. I think it's fair I just have a little response to some of those points.
Go ahead.
So, in terms of, you're quite right, we have had excess deaths significantly above the 5-year average in previous flu epidemics. We haven't had 80,000 excess deaths from a flu epidemic in this country. That's just not the case. But also,
I didn't say we have.
It's also based, and this is a really critical point, not only haven't we had anywhere near 80,000 excess deaths from a flu outbreak, that's despite the fact there haven't been. Let me answer that, Peter. So I'll just make this point. I'll make these little points. Then I promise you can come back on them. With the flu is allowed to just circulate around the population without restrictions. In this case, we've had 80,000 excess deaths whilst we've had huge restrictions, which have prevented the vast majority of people in this country from contracting coronavirus. Now, if we'd allowed coronavirus to circulate like flu, those number of deaths would be much higher. And that point is a really important point about when people died. This idea that these are very old people who were going to die soon anyway. Repeated studies, including one in the United States recently, found that those who died after contracting COVID-19 on average lost nearly 10 years of life. And part of the problem when we talk about underlying health conditions, which has always been discussed in relation to COVID-19, is there's a misconception amongst some that means they're at death's door. But in America, a quarter of people under 65 have underlying health conditions. Now, clearly, obesity and other of these conditions definitely increase the risk of dying from COVID-19. And the other point is, and this I really think speaks to the point you're making about the economic impact, is the studies show, including one study from 49 nations in the OECD countries, these are advanced economies across the world, using COVID-19 data and economic data, found that those that locked down the swiftest and harshest tended to have a less bad economic impact as a consequence. That the problem with our case is the government locked down too late, allowing the virus to enter into broader circulation than would have been the case otherwise, that if they'd locked down earlier, the infection, the outbreak would have been less, the lockdown and the disappearance of consumer confidence would have been less, and we would have had, instead of having the worst death toll and the worst economic hit potentially in the whole of Europe, we've got the worst of all worlds at the moment, we would have had less of an economic impact and less people dying. So that's the point I'd make to you.
Well,
yes, you're right, there are excess deaths caused by flu, but there's not a precedent for those excess deaths, and that's despite these extreme measures. If we locked down quick, it would have been less severe, and people are dying 10 years before they should have done.
There are comparable precedents for those excess deaths, not exact ones, is my point. And they're not out of the same class. But your most fundamental assertion, and one for which you can produce no evidence because there isn't any, is that these shutdowns actually prevent the spread of the disease. I don't think anybody actually believes that the spread of the virus can be prevented. All it can be done, even in the view of the advocates of these measures, is that it's delayed. The famous flattening of the curve, the squashing of the sombrero, which we were promised would be achieved by Mr. Johnson's shutdown. And the key statistic here, which demonstrates that this didn't actually happen, is that in this country the number of deaths peaked on April the 8th, and the shutdown was announced on March the 23rd, and I suppose one could assume it was underway within a couple of days. But let's assume that the shutdown actually began on March the 23rd. That's 7 days of March plus 8 days of April. That's 15 days. But the time from infection to death of coronavirus is roughly 4 weeks. So here's the simple fact: the peaking of deaths did not result from the shutdown.
The problem with
as I said before, repeated examinations of the congruence or connections between severity of shutdown and numbers of deaths do not show any such congruence or any such result. So not merely do you not have any causal proof that these measures have prevented the spread of the disease, you don't even have a correlation on which to base it. And you should stop saying it. But the whole thing is, because this is universally accepted by the BBC and by the government and by a very large proportion of the media, you can go around saying over and over again, well, these lockdowns saved lives. These lockdowns.
I mean, just
absolutely. You had a very long go, and I restrained myself with huge determination from interrupting you. So please do me the same favor. There is no evidence that these measures did what is claimed, and it's only because there is a ridiculous, unchallenged consensus enforced by what is effectively state broadcasting and frankly supine media coverage that the question isn't constantly asked: did these things work? No, they didn't. There's no proof that they worked at all. What we do know, absolutely for certain, is that these shutdowns have destroyed immense amounts of jobs and businesses, have reduced huge numbers of people to utter lonesome misery, have devastated the health service, have led to very large numbers of completely needless deaths of people who were deprived or deprived themselves of necessary medical tests and treatment. And we know this, and the price of them has been colossal. And it really is a case here of, yes, comrade, I see your broken eggs, but where is your omelette? Masses of broken eggs as a result of this policy, and the economic consequences. And of course, if I talk about the economic consequences, someone, I hope not you, will accuse me of caring only about money and not about life. But the economic consequences of this have been so catastrophic that people can't even begin to imagine the narrowness and misery of life in the future, which is going to be visited on people as a result of an economically, politically, and medically illiterate government imposing on the country disastrous measures which were wholly ineffective, totally unnecessary, and deeply damaging.
So on the point you make about when deaths distanced compared to when the national lockdown was introduced, which you're quite right, was the 23rd of March on the Monday when Boris Johnson addressed the nation and ordered the total shutdown of the country imposed by law. You're absolutely right about that.
I know I am.
What I think is important to note is 1 week earlier, the government told people not to go to their offices, not to go to the pub, and to avoid non-essential travel. And obviously, a few days after that, before the lockdown, all pubs, bars, and those were shut down in the country. And even before that week before, when the public were told to socially distance, it wasn't imposed by law. Millions of people started to do that. Indeed, many had started to do that before that Monday. But the difference is, if the government, and this is the point about the economic devastation, and that's why the peak in deaths you're talking about doesn't seem to correlate in the way you would expect on the 23rd, because millions of people were already taking drastic measures. Just really that point, that absolutely critical point about the economic consequences, the studies show that countries which managed to contain the virus, which took measures earlier on, had less of an economic consequence than this country. We've got the worst death toll in Europe, and also one of the worst economic consequences. If we looked at it, we wouldn't.
The problem with this country is that it's largely destroyed its manufacturing sector, which is something I think we could both agree on.
Yeah.
And therefore extraordinarily dependent on its service sector. And the measures which the government introduced were particularly devastating to a service economy such as we have. And if the economic results were worse, that's almost certainly the reason for it. Sweden, for instance, which we could discuss, but let's probably not, in general, has had some bad economic consequences from its non-shutdown. But this is largely because Sweden has maintained a fairly considerable manufacturing and export sector. And of course, with the rest of Europe strangling itself, if you have a manufacturing export sector, it will suffer from a loss of business from other countries. So you have to look at these things with a bit of care before you draw conclusions from them. And that's what I'm saying here. But I don't. If you either you think that these shutdowns are effective, or you don't. If you're going to say, well, actually, yes, the fact that the people were staying home before the shutdown voluntarily meant that the deaths peaked on April the 8th, which I don't think is true. But if you are going to say that, then you can't simultaneously say that the shutdown was beneficial. You would then be able to say that the Swedish approach of letting people make their own minds up would have been just as good. But in fact, the pattern of the virus is a pattern which is very often followed by viruses, and I don't believe there's any evidence at all that what we did in any way altered its progress. It did what it did, and then it faded away. And we currently have a largely statistical second wave, which the government is struggling by dispatching huge numbers of people into the country and advertising frantically for people to come and be tested, is struggling to maintain through statistical means.
Well, we can see that.
It's which the original wave of the virus is a pretty standard pattern. If you look at viruses,
well, I mean, on that,
all the way. That's what it did, and there's no evidence at all that these frantic and destructive actions which you support did anything to prevent or lessen it.
So, well, I mean, that's I would say very much not true, because what we saw with the first lockdown, and you're right in terms of it, there was voluntary measures were encouraged beforehand, but that was never going to be sufficient, and we wouldn't have brought down the deaths anywhere near as we did. If you just look quickly at those, as I showed before, I won't flash it up again. But just quickly, the graph.
I'll argue with you about what may or may not be right. But if you're going to say something is not true, then you're going to have to demonstrate the truth of your position.
I am.
I absolutely defy you to do so.
Okay, so let's see the graph again. Let's see the graph. Let's have a look at the graph quickly. Why, Peter? Why? Because when we're talking about flu, by the way, this is not the good season for the transmission of viruses. It wasn't in the winter. Why did it go up so steeply and then so steeply decline as lockdown measures kicked in? That shows, and we've seen this across the world, if you stop people interacting with each other, then by definition, they can't spread the virus to each other. That's why the infection rate collapsed and then eventually gradually came up again as the winter months come in and people are inside more.
We just agreed that the lockdown measures didn't kick in. We just agreed that they couldn't conceivably have kicked in quickly enough to produce that result.
They did.
No, they couldn't have done.
They just started. The infection rate started to come down, just not sufficiently.
Owen, answer me a series of questions. What is lockdown supposed to prevent?
Lockdown is to stop people interacting with each other in close proximity, particularly indoors.
With the aim of preventing what?
Of infecting one another with a contagious.
Time from infection, which you say lockdown is supposed to prevent, the time from infection to death is approximately 4 weeks.
3 to 4 weeks.
How long? No, approximately 4. How long? Assuming which is probably untrue, that lockdown began the moment Johnson ordered it on March the 23rd. How long is it from March the 23rd to April the 8th?
But as I pointed out, lockdown. As I pointed out, millions of people started to isolate before that because they were told to by the government.
If the
infection rate came down,
lockdown were preventing
compulsory lockdown.
Lockdown were preventing infection, then it couldn't conceivably, given a period from infection to death of 4 weeks, it couldn't conceivably have led to a peak of deaths on April the 8th.
Of course it could, for the reasons I've explained. People, if you had less people interacting with each other because people were working at home, traveling less, socially distancing from each other, which took place significantly before the national lockdown, which is the only way of bringing down infections in a drastic way, then of course you'd have a peak on April the 8th.
I'm sorry, I've just won this bout and you haven't noticed.
But you haven't, Peter.
No,
by definition, the infection rate started to come down, but not anywhere near the amount needed without compulsory lockdown. That's why we had a compulsory lockdown.
Infection to death is 28 days. The time from from Johnson's shutdown to the moment when deaths began to fall is 15 days maximum. What's the difference between 50 and 28?
Yeah, but the week before the lockdown, people in those 2 weeks beforehand, particularly a week before, millions of people voluntarily, at the instruction of the government, started to. So by definition, Peter, think about it. Of course, there were lower infections because people started to socially distance, wash their hands, and all the other things we were told to do. But not enough. That's why we had to have a drastic lockdown, which then would mean a sustained collapse in infections.
No, but this is a nonsense, because what you're saying is that without the lockdown, which you say created these results, without the lockdown, the infections were already being reduced. You can't have it both ways.
No, Peter. The point of a lockdown.
The story of the Chinese executioner. Would you like to hear it?
Go on.
Okay, well, there's a very, very famous Chinese executioner who used to go around China cutting people's heads off with such skill and artistry that crowds had come to watch him do it. And on one occasion, he came to a small provincial town, and he was confronted by the condemned man, and he came into the execution chamber in front of an invited audience who paid good money to watch, and the executioner began to twirl his sword about in a rather, frankly, finicky manner. Did this about 5 minutes, and eventually the condemned man said, "Well, I keep hearing what a wonderful executioner you are, but so do you think you'd mind not faffing about anymore and just get on with this?" And the executioner said, "Kindly nod, please." Because the victim nodded and his head fell off because he had already been executed. The same thing's just happened to you. You just don't realise you've lost the argument.
Peter,
I can't do it anymore.
It's such an obvious point. Let me just put this to you, just so we're absolutely clear. If you tell the nation there is a deadly virus in circulation, that they should not go to the pub, they should not go into the office, they should not travel, and they should not socialize, then you will get a fall in infections. But it will go down only to a certain level because it's not enforced by the law, and therefore a significant number of the population will not observe those instructions which are not backed up by law. That's what we had before the lockdown was announced on the 23rd. So of course, infections were going to come down from where they were based on telling people there's a deadly illness and you need to avoid doing these things. But they would only come down to a certain level unless you then have a compulsory national lockdown, which is then what happened. I don't know why that's hard to understand, but it's a very, very basic fact. And the point you made about Sweden has had 6,798 deaths. Norway has had 334, and Finland's had 399.
You're wasting time. It's not a fact. It's an opinion which you hold, which you can't actually back with fact.
Well, I can point out that less people are being infected, and therefore, as a consequence.
You're welcome to it, but it doesn't. And also, it's contradictory for you simultaneously to say that lockdowns were necessary because they prevented deaths, but also then to say, but actually, before we had a lockdown, we were.
I'm saying that if you have voluntary measures, you can only bring infections down to a certain level, and we would still. And the point you made about illnesses is hospitals would have been overwhelmed because they wouldn't have been able to treat those other illnesses that quite correctly you speak about.
They might have been, but they weren't. And actually, there was absolutely no.
Because of lockdown.
no sign at all that they were going to be. And Fraser Nelson has written a very interesting article on the lack of overwhelming in our hospitals at the time, which simply didn't exist. And it only needs to be looked up to find. He got hold of the figures, and I commend it to you. Okay. But I can't. There's no point in going over this. What you're mistaking your opinion for a fact. I'm just
pointing out that if you have social distancing before a national lockdown, you will bring down infections, but just not to the degree that you need to prevent lots of people from dying and the NHS from being overwhelmed. But we're going round in circles, so we should probably wrap this up.
I'm staying in the same place. You're going round and round in a circle, round and round me. Your argument is indeed circular. Nothing can assail your position.
Okay, well, I have been decapitated. As you pointed out, my head has been removed. So we should probably leave it
without noticing it. It's a good metaphor for that.
Okay, as I've said, my head has been duly decapitated. Honestly, finally, let's just wrap up quickly. What do you think is going to happen next? So that's what I want to hear. Do you think the Conservative government will survive the turmoil that will come even if mass vaccination happens?
I'm not sure our political system will survive the turmoil which comes when people realize just how much damage has been done to our society by these buffoons. When people find that they have no jobs, no prospects, they can't pay their rent, they can't pay their mortgage, their businesses have collapsed, their children have no future, they themselves have no chance of anything approaching a job resembling what they used to have, when they find out that the country is immensely poorer, that the National Health Service, which they bang their pots and pans for in March, April and May, is a shriveled shadow of its former self, and so are all the other public services from the railways to the schools. When they find out what has been done to them by these buffoons, I think there will probably be a considerable political revenge, and I would imagine the Conservative Party will take the brunt of it, but I don't think the Labour Party will escape because it failed to oppose it. And our political system may well enter a new and extremely unpleasant era, which I don't personally look forward to. I don't want to live in an impoverished country where everybody is justifiably angry. But I think that's why I fought against it so much. I never wanted this to happen. I simply wanted to prevent it. I wanted governments to act proportionately and sanely, and instead of as they have done. But I've failed. Those of us who've opposed this have failed. We've never reached more than a very small minority of the population. You've won. You've won in terms of public opinion. But what will happen now will be so unpleasant that it will render all this largely irrelevant. I've never seen debt on this scale. I've never seen the destruction of employment on this scale. I've never seen the wrecking of people's educations on this scale. I've never seen social dislocation on this scale. I've never seen the deliberate spreading of misery, particularly among the formerly healthy old on this scale, and the mistreatment of people in care homes and the separations of families. It's appalling. And as I say, there will be a price to pay, and it won't necessarily be a rational price. And I can't see that the Conservative Party will survive it, because people will undoubtedly blame them, as they blame them for the much smaller catastrophe of the exchange rate mechanism for many years afterwards. I think they're settled with that, and I think they probably know it. But the whole political system is what is in danger. The whole stability of our society is in danger. This is a colossal thing, and we will be paying for it for a very long time indeed.
Well, on that cheery note, thank you very much, Peter. I will take my decapitated head away with me. It's been a real pleasure. We disagree. We agreed on some and strongly disagreed on others, and that's how it would work. But I hugely appreciate it.
I think when one has disagreement is vital. If there is no disagreement, the truth will not be discovered.
Amen.
You're my opponent, not my enemy. Let's keep it that way.
Absolutely. Cheers, Peter.
Thanks a lot.
Feisty. I did promise you from the start that I would interview people I don't agree with, and I think Peter definitely qualifies. Although there were things I did agree with him on, things I definitely didn't. But we've got some amazing videos coming up. Documentaries, not least about the plight of refugees in this country. One of the most important things that I've been involved with. We need your support. We've got a growing team being paid union wages in an economic crisis. If you want this channel to continue and to expand, please give whatever you can to Patreon/OwenJones84. That's patreon.com/OwenJones84. Subscribe to the channel and also press the notification bell on the YouTube page so you get notifications. Thanks for your support. We've got some amazing interviews to come, including Noam Chomsky, eclectic, someone who had a huge impact on me in becoming a writer in the first place. But what a pleasure, and I will see you soon. Spread the word.